as you go through the workshop, you don't have to answer this out loud, but as you think about your health right now, are you as healthy as you want to be? Is your family, are they as healthy as you'd like them to be? You guys mind if I share a little bit about myself with you guys? Is that cool? So people have asked me in the past, Dr. D, why did you become a chiropractor? Why are you so passionate about chiropractic care? And this is the reason, right? So this is a picture of me and my wife, Lydia. Those of you that didn't know, the cute blonde behind the front desk, that's my wife, Lydia. We got married in 2020. And these are my grandparents. This is my grandma, Joanne, and my grandfather, Bob. And I'm originally from Illinois. Now, when people hear that, they instantly think I'm from Chicago, and that's like furthest from the truth. I'm from Central Illinois. I grew up in the center of the state. We're like 3 hours away from Chicago. Flatlanders, cornfields, all the things like Nebraska, right? So you just minus Chicago. Illinois is a lot like Nebraska, just minus all the corruption. But my grandparents, I grew up going to their house weekly. They lived on an acreage, and I remember my grandmother, she's kind of where I get my personality from, and she was like a go, high energetic person when I was growing up. She was always in the flower beds. She was always doing chores around the house, shopping till her knees drop and spending my grandfather's money and annoying him. I'm just kidding. But when I was in undergrad, I was getting my bachelor's degree in exercise science. And a little bit about my background with school. I was really active as a young kid, played basketball, football, college football. I loved performance, and I wanted to do something to help people perform better. So when I was in undergrad, this is about 14 years ago, she had fell in her kitchen on a rug. She tripped on a rug and she broke her hip. And she went to the medical doctor, and they said, "Hey, Joanne, you have a broken hip. We need to perform a hip replacement surgery." And a little bit of background on her health. She was a smoker for about 37 years. She smoked almost 2 packs of cigarettes a day for 37 years. And I tell you, the worst smoker's cough you've ever heard. We could be shopping in Walmart, and we could be in the back, and you could hear her hacking along at the front. That's how loud it was. So she was at the medical doctor, say, "Hey, you need a hip replacement." And they said, "Joanne, just so you know, because you've exposed yourself to 37 years of toxic cigarette smoke, when we do this incision, there may be some complications as far as how the surgery goes. We don't expect it to heal as fast as a typical person." So just like that, she went cold turkey. She still has, to this day in 14 years, has not smoked a single cigarette. And we're like, "Oh my gosh, this is amazing. Grandma finally stopped smoking." We've been on her for years. But unfortunately, that was really the first domino that led to a lot of the health issues that she struggles with today. Since that surgery, for about 7 years, she had a wound vacuum that she would carry that was constantly sucking pus out of her leg that my grandfather every morning, every night would have to clean after. She has had 4 hip replacements on that same hip. A hip replacement on her opposite hip. She has had her left great toe amputated from gout. She's missing about 8 inches off of her colon, and she's constantly in and out of the hospital. The first time Lydia ever met her was actually in a hospital bed on Thanksgiving. All right, and as she was going through all this, I was in school, and I was thinking to myself, what do I want to do with my career? And I just kept asking the question. My grandmother, she keeps going to doctors, but she keeps getting sicker. Right, she's taking more medication, she's getting more surgeries, and that's eventually what led me to chiropractic care. So when you guys come into our office, how I look at you is I could only have prayed and wished that someone would have been in her life to actually sit down with her and said, "Hey, Joanne, these are the lifestyle habits that we need to start working on to better your life so you can spend it with your friends and family." That's what we want for you guys, okay? So when you guys think about this workshop, the purpose of this workshop, we are going to give you some do's and don'ts, but the biggest thing that I want you guys to take away when it comes to your health, it's all about mindset, okay? I could teach you for days, I could teach you for weeks on what to do, what to not do, but if you don't have the right mindset, then you don't have the right behaviors. If you don't have the right behaviors, what you do outside of here isn't going to matter, right? So we have to get the mind right first. So when you guys think about this question, are Americans healthy? What would the crowd say? Okay, that was like a resounding no. Why do you say no?
We're not. I mean, we just eat like crap, you know. We don't have the time to cook all the time, like work, school, stuff like that.
Poor food quality. Byron, any thoughts?
Lack of activity for most people.
Lack of activity. Awesome. Everyone agree with some of that, right? So this is what the research shows, guys. So this is on your sheet. Now, everyone, I forgot to mention this at the beginning, but there's a fill out sheet that as you guys go along, it helps you retain some of the information. We'll actually take that top sheet before you guys leave, and underneath there should be a blank piece of paper. You can jot down any notes that you want along the way, and you can actually take that one home. Now, in America, we practice what's called Western medicine, okay? Now, Western medicine, the viewpoint of Western medicine comes from an outside-in approach, okay? Meaning if you have back pain, neck pain, some type of disease, a disability, you're going to go to a doctor and they're going to treat you from something outside of your body, like drugs or surgery, an outside-in approach. And the mindset that us Americans have are typically wait till Humpty Dumpty's broken and put Humpty Dumpty back together again, right? So this type of mindset, when we think about chronic disease often starts silently, meaning you can't initially feel it. And over years, then we start to see the symptoms like obesity, heart disease, diabetes, cancer, stroke, infertility rates are skyrocketing in this country, right? Dementia. These types of chronic diseases over the past 50, 100 years have been consistently going up as far as the percentages in Americans, and it's how we look at our health from this outside-in approach. So tonight we're going to teach you a different perspective, which is an inside-out approach. Okay, so if you guys were to guess which country spends the most on healthcare, what would you guess?
The United States.
The United States, yes. Okay, now I need to update this slide. New research shows 4.2 trillion. We spent $4.2 trillion last year on the treatment of chronic disease. 4.2 trillion. That's more than double the next closest country, more than double. Sometimes when we do a workshop like this, I'll have people say, China, Canada, they have really bad taxes, right? More than double the next closest country. Okay, if you guys were to guess which country takes the most medicine, what would you say? U.S.? Yes. Here's the brutal facts. We make up less than 5% of the world's entire population. We consume 75% of the world's prescription drugs. Think about that for a second. You got it right, Barb? Good job. 75% of the world's prescription drugs and only 5% of the population. Has anyone here ever heard of an opioid? Alex, what's an opioid?
It's a narcotic medication for pain.
For pain relief, right? Now, you cannot get opioids just over the counter. You have to go to a doctor and be prescribed. And unfortunately, in many cities, people are getting this, on the streets. So we consume 80% of the world's entire supply of opioids. And back in 2015, this is around that time, this is when the opioid epidemic started to become really popular and people started to learn about it. And in 2015, these numbers were at 100 or 75 to 100 people per day. A decade later, 175 to 200 people every single day in this country die from opioids. And these are not people that start off as bad people or drug addicts. These are the people that I'm looking at right now. These are the people who struggle with chronic pain. They go to the doctor, they get involved in the system and get addicted to these drugs, and they don't get to the root cause. And eventually they get toxicity and they pass away, right? So what makes me sick is how we look at our health. Would you guys say we're more proactive or reactive? Reactive. How do you think that affects our kids? Okay. Now, the Center of Disease Control in 2009, they did a study, and they looked at age. How long are we living? And they're finding that the first time after 2000, the first time in our country's history that children who are born after the year 2000 do not have the same life expectancy as their parents. Life expectancy is going down in this country. And this, again, comes from this reactionary lifestyle. Okay. Now, the World Health Organization, they looked at all the developed countries. There's 40 developed countries, and they ranked them in overall health. Number 1 being the healthiest, 40 being the least healthy. Where would you guys guess that we fall on that list? I heard a 38, I heard 39. I got a 30, I got a 30, I got a, right? Number 38. 38 out of 40. Okay. Now let's pause and think for a second. Okay. Anyone ever bought stocks? When you buy stocks, the general rule of thumb is you want to buy low, sell high. In other words, you want a good return on your investment. Okay, now think about our investment. $4.2 trillion. Kids are getting sicker. We take the most drugs. 200 people are dying every single day. Chronic disease is going up. And the only thing that we can show for it is 38 out of 40. Is that a good return? It's a horrible return, right? So how we look at our health, it has to change. Otherwise, we're just going to keep getting the same results and even worse.
Netherlands.
Number one.
France.
Oh, really?
France.
In case that is funny.
So there, it is kind of odd because whenever I think of like a Frenchman, I think of them eating like a baguette and smoking a cigarette, right? But they just think of us just eating, Cane's chicken all day, right? Right. So why are we in this health crisis? And there's been a lot of research over the years. I think COVID really jump-started a lot of this talk, which was one of the good things that happened from COVID. But I remember I've been doing this workshop for almost 7 years now, and I remember asking people, why are we in this health crisis? And during COVID, people started answering questions about COVID. And I said, oh my gosh, our world is just getting sicker and sicker, right? So there's three main reasons. There's this large study they looked at. Why are we seeing these trends? And they pointed it to three main reasons. Number one is personal responsibility, or lack thereof personal responsibility. So I used to be, June will be my 7th year as a chiropractor. When I graduated, I moved from Davenport, Iowa, and came to Nebraska. And I practiced in West Omaha for about 4 years. And when me and my wife decided to open up our practice here in Papillion, we moved here to Papillion, and she used to work in a dental office. And she used to be the person that when you call, she'd answer all your questions about billing and medical information, all that stuff. So she said, hey, we need to find a new dentist. We're moving to Papillion. And I said, you're right, honey. You need to go find us a new dentist because you know everything about dentistry, right? So we put the responsibility of our health in the hands of our spouse or a loved one to make decisions for us, or we put it in the hands, literally or figuratively, of our doctor to make our bodies healthy, or we put it in the hands of the insurance companies or the system, right? Ultimately, who's responsible for our health? We're responsible. Okay, number two is the wrong definition of health, or the simply lack of education, okay? Now, if you guys and I were to take a field trip right next door, and on a given workday, we visited Eileen's Cookies, and we interviewed people coming in and out of Eileen's and said, hey, sir, ma'am, what's your definition of health? Do you believe that you're healthy? Well, from my experience of being a doctor and treating thousands of patients over the years, how most people look at their health is, if I look good or feel fine, I'm healthy. That's how most people look at it, right? You guys ever heard of Farrah Fawcett?
Yeah.
Patrick Swayze? You guys remember what those celebrities passed away from? Cancer, right? So when we think about chronic disease, all chronic disease starts insidiously, okay, meaning silent. There's no initial symptom that you feel, but over years of not getting the right tests, or treating your body poorly, you start to notice a cough, and then you start seeing blood in the stool, and then you go to the doctor, and then holy cow, you have stage 4 cancer, right? So true health is not how we look. True health is not how we feel. True health, our definition of health in this office, is your body's ability to adapt to stress. Chew on that for a second. Your body's ability to adapt to stress. What happens if an animal cannot adapt to its environment? It dies, right? So we're going to teach you some different types of stresses in your life that causes your body's inability to adapt and helps you adapt to those stresses. Number 3, I'm going to leave you on a cliffhanger. I know you guys are so engaged right now. We're going to talk about this in a little bit. Okay, so before we get into some do's and don'ts, guys, there's really 10 fundamental questions that we need to ask ourselves that will really help direct some of the behaviors that we have outside of here. Okay, so I like to call these truisms. Hopefully you guys find this easy, but I will say when you apply these concepts in a real world experience, sometimes this can be kind of difficult. Okay, so number 1, are you designed to be healthy or sick? Healthy or sick? Healthy, right? I hope you find this easy, right? We're designed to be healthy. Our body's natural expression of life is to be healthy. Being unhealthy is not normal. So, for instance, is back pain common or normal? Is high blood pressure common or normal? Everything's common, right? It's not normal. So sometimes when I come into a new patient exam and I sit down with a patient and they say, yep, I have these normal headaches that happen once every other day, I say, wait, hold on a second. That's not normal. I'll ask, hey, I saw that you put high blood pressure on your paperwork, and they say, oh, I got that taken care of, doc. I got medication for that. So, is your blood pressure really under control? Is it really taken care of if you need medication? Right? Our natural design is to be healthy, right? Is your body smart or stupid? Smart. Now, if you guys watch the news about around COVID times, whether you watch Fox, CNN, MSNBC, did you get the idea that the mainstream media was trying to convince us that our bodies were smart or stupid? Stupid, right? Stay away 6 feet away from people. Germs don't last 6 feet away. You have to wear a mask, right? Now they're coming out and they're like, oh yeah, that was a bunch of BS, right? All right, everyone in this room knows what this picture is of, right? Okay, if you don't, you may need to call mom and dad and have a conversation, right? So we have a sperm, we have an egg. They collide, that forms some DNA, right? Over time, that replicates into 2, into 4, into 4, into 8. And you just think about that. There is an inborn intelligence that governs that whole process. Our bodies are vastly smart, smarter than our innate intelligence, or excuse me, our educated intelligence. Our inborn intelligence is smarter than our educated intelligence. Now, what system in our body helps us adapt to stress? Some of you really paid attention here. Our nervous system, right? So here's an example. If chiropractic care has been kind of confusing of what the point is, I'm going to help break it down for you. Okay, everyone's seen this type of box in your house? Now, growing up, I lived in a very small town. About 400 people were in this village, Congerville, Illinois. We called it a village, 400 people. The house I live in was about 150 years old, and the wiring was horrible in this house. Has anyone ever plugged in something, an electrical outlet, and then the power turns off? Right? So you go find this box, and then you open it up, and you find the switch that doesn't look like all the other ones. You flip the switch, you turn the power back on, and now you can use your TV or your hairdryer or KitchenAid mixer, right? Guys, that concept, that's chiropractic care. Okay, so there's certain stresses that you put yourself through on a daily basis that you overload the system. And when these stressors go unchecked, this causes a breakdown of our body and our spine. Okay, now, what is the S word that Dr. D likes to use a lot in this office when it comes to the spine? Get your head out of the gutter. Get your head out of the gutter. Just kidding. Subluxation, right? So subluxation, when we think about the spine, the brain, that's the power source of the body. The brain sends the messages down the spinal cord throughout the nerve roots, the wiring that goes to the heart, the lungs, the kidneys, all the cells, all the muscles, right? And these communicate back to the brain. There's active communication between both parties. Like many problems in life, poor communication is the result of bad things, right? Similar with our health. When we have poor communication, problems happen, okay? So when we overload this system with certain stresses, we'll get here in a second, that causes a breakdown known as subluxation along that communication pathway and causes not only pain, but bodily dysfunction. Okay, so our job as a chiropractor is to find where you have stress on not only your spine, but your nervous system, the master control center, and apply an adjustment, flip the switch to allow for full communication so that you can heal without drugs or surgery. Mic drop. Which is in the workshop right there. That's pretty cool, right? Right. So one of the things that people started to become enlightened about chiropractic care is, guys, the whole purpose of chiropractic care is not about back pain. It's about restoring communication. When we can restore communication and take stress off of your nervous system, overall better function, which not only means pain, better sleep, better energy, better focus. We've seen things like, I'll get to that in a second, but when we think about overall function, what protects your nervous system? What protects the nervous system? Think really simple, guys. Your backbones, right? Yes, when you think about what protects your brain, your skull is you're protected by your brain is protected by your skull. It's like a helmet, right? Your spine is your very own suit of armor. We have to treat this well. We only get one suit of armor throughout our entire life. You guys have any stress in your life? It's just me, right? We all have stress, right? Sometimes patients tell me, "Oh, I don't have any stress, Dr. D." It's like, you realize gravity is a stress? Gravity is a stress. We all have stresses. What are they? Okay, number one is mental stress. Okay, on your guys' blank sheet of paper, I'm going to have you flip to that blank sheet. I want you to write down mental stress, aka thoughts. Okay, where does your mental stress come from? Does it come from work? Does it come from family? Does it come from inflation? Does it come from society? Are there certain people that are in our lives that we need to reconnect with because they fill our cups up? Are there certain people that drain us of energy? We may need to pass them along, right? We live in a very mentally taxing society. I could go on and on and on, but I don't want to overwhelm you guys. Number 2 is chemical stress, aka toxins. Smoking 2 packs of cigarettes a day for 37 years. That's a toxic smoke. That is a toxic issue, right? Are you getting good nutrient-dense food that you're supplying your bodies with? Or are you eating McDonald's every day and guzzling down Monster Energy drinks? Air pollutants, Canadian wildfires. We have certain things that we put in our hair, certain things that we put under our armpits that cause toxic issues with our natural function. And then lastly would be physical stress. So most people, when they think about physical stress, they think of macro traumas, big traumas, car accidents that they've sustained, sports injuries, we talk about motor vehicle accidents, but the things that most people don't think about, guys, are these micro habits, these small, repetitive, day-to-day habits. Those are the ones that get us. I like to say if God wanted us to sit all day, he would have given us 2 more legs out of our butts. Okay, our bodies are not designed to sit all day. Our bodies are not designed to have these. Research shows the average teenager spends 7 to 8 hours a day on his cell phone. You think it's more common now that they're developing neck issues, right? So these types of stress is mental stress, physical stress, dietary stress. They add up in a given day, over weeks, over months, over years, that causes a breakdown. Is this making sense, guys? Okay, so has anyone ever heard when you go to a chiropractor, when you first start going to a chiropractor, you need to go for the rest of your life? I've heard that many times. And usually when people say that, it's like, oh, the chiropractor, they're trying to get you addicted and they just want to pull more money out of you and it's just a sham, right? Okay, let's use logic for a second and think about this. Look at this slide. Why would it make sense that routine spinal care throughout your lifetime would be a good idea based off of this slide? Because these are always going to be there, right, guys? If these are not here, that only means one thing, and that's you're 6 feet under. Okay. Here, I'll use this concept. Everyone in here, I hope, brushes their teeth. Okay. So if you eat food, you're inevitably going to get dental plaque. And if you don't brush your teeth, you're going to get cavities. And then over time, your doctor's going to have to rip your cavities out. That's what dentistry used to be 200 years ago. You go to the doctor, they rip out your teeth, they give you your wooden dentures. Okay, but then they started to find out that, hey, if you clean between your teeth, you get rid of the bacteria that cause all this acid buildup. If you start to brush and floss, you can actually be proactive with your teeth, and then you won't have to have your teeth ripped out. But guys, I can't open up your spine twice a day in the morning and at night and clean in between the vertebra, right? That's called back surgery. You guys don't want back surgery, right? Right? So there's certain things if we apply adjustments, start to focus on these certain habits, it's not, you have to go for the rest of your life. The question is, how long realistically can you hold an adjustment based off of that? That's the real question that we're after, okay? Now, how does this stress affect us in our physiology? Okay, I talked earlier about, okay, if we start adjusting the spine, there's other things that can improve aside from just pain. Well, I'm going to show you this is how. Okay, so I don't know if you guys knew this or not, but like a year ago, there was a mountain lion running around here in Papillion, and people with their doorbell cameras were like, hey, I saw the mountain lion, right? Imagine when you're leaving the workshop, you can't unlock your car, and all of a sudden you hear a big growl and you see big teeth and there's a mountain lion outside, right? Okay, this is how your body would adapt to that stress. In a split second, a portion of your brain, the fear center of your brain, the hypothalamus, would send a nerve impulse all the way down to your adrenal glands. You guys know what the adrenal glands do? What do the adrenal glands do? Adrenaline, it's in the name, right? It also releases cortisol. These are stress hormones. Are stress hormones good or bad? I heard bad. Depends, bad.
Good and bad.
Good and bad. Okay, just like Goldilocks, right? That is the correct answer. It's good and bad, right? So we don't any problems when it comes to health. It's because something is too toxic or something is too deficient. Just like Goldilocks. We don't want too hot. We don't want too cold. It needs to be just right. When things aren't just right, problems happen. Okay? So in the short term, stress hormones are good. This is what happens in the short term. You see the lion, adrenaline, cortisol rises, your heart rate goes up, so you can get more blood flow and oxygen to your body. Your blood sugars go up, so you have energy to run and punch that lion in the face. Your digestion slows down, so hopefully you don't poop your pants. Okay? Now, we're primitive beings in nature, and what happens, God designed us this way when we didn't have refrigerators, that we used to hunt and gather our food, right? Okay? So our body's natural way of responding to stress when we're under periods of famine is to hold fat around our midsection so that we can use that fat for energy later. Okay? That's in the short term. Now let's think about the long term. Our blood sugars go up, our heart rate goes up, fat around our midsection. Does this sound like anyone you guys know? Right? So when people are chronically stressed, those are the symptoms that we see. High blood pressure, high blood sugars, high blood cholesterol, fat around the midsection. And when we can start to help your body de-stress the nervous system, these are the symptoms in our office that improve. My sleep quality improves. My sex drive goes up. My kid's focused. My kid can actually sit at the dinner table and be present with us at night, right? Allergies, blood pressures, these are the issues that we see resolve. Okay, so how early can subluxation start? Subluxation can start, Barb, we just had a conversation about that today, right? Right, so subluxation can start as early as birth. Now it's estimated that in a normal birth, 45 to 90 pounds of cervical tension happens on a baby's neck. Just imagine yourself in a gym with a 45-pound dumbbell just dangling from I know it's gruesome to think about, but that's in a normal birth. C-section births are way worse. There's usually an emergency. The kid may be in a poor position when they come out. They may have an arm or foot in the wrong position, and then they have a hip issue that has been caused from birth. Now they have a shoulder issue that's caused from birth. They grab them with forceps or vacuum extraction. Now they have instability in their cervical spine. Typically when we see a vacuum extraction or C-section on the damage to the neck, that kid will often come in with concentration issues, chronic headaches, chronic ear infections. Right? Chiropractic care is dangerous for children. True or false? Definitely false. Okay, here's a few of our kiddos that we've highlighted in our office. This is Mila. She is in gymnastics, and her mom, Cheryl, brought her in and said, hey, my daughter does this all day. Do you think that would be a good idea to have her spine checked? And I said, yes. This would be a perfect time to have her spine checked. Gymnastics, football players, those are some of the most degenerative spines that we see as they turn into adults. If you guys are in the office with Bo and Vance, I apologize in advance, but they are rowdy and they love their adjustments. And when they get adjusted, they run around here and start doing push-ups and handstands. So just don't mind them. They're having fun. This is Katie. I asked her the other day, I said, Katie, what do you like most about your adjustments? She says, Dr. D, I love my adjustments because they make me feel good, right? When you think about who benefits the most from chiropractic care, anyone with a spine can benefit, right? Anyone with a spine. But the people who benefit the most are kids. Right? If we can start a kid young and healthy, they're going to turn into a healthy adult. Sick kids turn into broken adults. Right? You can always feel subluxation. True or false? False. Okay, so here's the $1 million question. If you can't always feel subluxation, how would you know you have one? There's a way. Yes, see a chiropractor, right? You have to have your spine checked. Just like blood pressure. You guys have heard of blood pressure, high blood pressure being the silent killer, right? So to know if you have high blood pressure, because the first symptom of high blood pressure is a heart attack. That's why they call it the silent killer. So if you want to know if you have high blood pressure, you have a test. You take your blood pressure. So if you can't always feel it, you have to see a chiropractor. So this is some signs that you may have or someone that you may know has subluxation. Signs we cannot feel. We can only see or measure signs. Symptoms we feel. Back pain is a symptom. Poor posture is a sign. Okay, so look at someone's posture. Are their shoulders even? Are their hips level? When you watch somebody walk, anyone ever notice someone when you're behind them, their feet flare out or flare in? Okay, that's a sign of pelvic instability. You can look at someone's shoe wear pattern. If you go on our Instagram or Facebook, I took a couple pictures of some guys recently who came in the office, and their shoes were like shaven sideways because they walk crooked. They're like this, right? That's pelvic instability. When you watch somebody walk, your gait should be symmetrical with both strides. If you want to play, which side's the bad hip? If you're out in public, right? The short side that strides, that's usually the bad hip. If I'm walking right now, which side's my bad hip? Okay, let's do this again. Okay, I'm putting all my weight on my right side. So usually the side that they lean to, that's the good side because they have the strength to stand on that side. We used to only see elderly people who looked like this. Now we see kids and 12-year-olds who look like this because of cell phones, right? Observation. Number 2 is instrumentation. So this device that we run up and down your spine each time that you come in, this is called a nervoscope. There's 2 metal prongs at the edge of this that are sensitive to temperature change. And subluxation, a misaligned vertebra, causes inflammation in that area, which changes the skin temperature, and it helps us identify where we need to focus on each visit. Okay. Infrared thermography, this type of scan, you guys have all had these scans. This helps us see how does your body adapt to stress. It does not show us where you have pain. Okay, someone who has green on both sides is typically more well-suited for their environments. Their body can adapt. Someone who has a bunch of orange and red is not well-suited in their environments and typically not only has pain, but more bodily dysfunction. Palpation, that's a term that we use as we feel the spine. Is our body smart or stupid? Smart. So this is how our body adapts to subluxation. Joint instability, subluxation, causes a weakening of the spine. So what the body does is it tightens the muscles in those areas to create stability. Right? So patients will ask me, Dr. D, is this a joint problem? Is this a muscle problem? Is it a nerve problem? It's all the above. It's all the above. We also are going to feel the joint to make sure that's moving correctly. Lastly is X-ray. When we moved here to Papillion, we called local offices and said, hey, do you guys take X-rays? We knew that we were going to take X-rays, but we were just curious. About half of the offices in Papillion take X-rays, okay? So if you guys are more analytical, you know someone who is, maybe not cynical, but more skeptical about chiropractic care, and they just want to know, well, how do they know what to adjust, right? This is the 5-step process that I do each time that you guys come in. We look at your X-rays, we palpate, we do an inflammation scan to know where we need to adjust. What do we need to do to correct problems with our nervous system? Simply put, guys, we got to start taking action with these problems. So this concept, very important, okay? When you guys are at your 4-month re-exam, we're going to sit down and I'm going to ask you, how well did you do with this concept, okay? Now, I will say the patients over the years who have actually treated this with some urgency and focused on this are typically the ones that we get to celebrate at 4 months. And the ones that are like, yeah, I didn't do that, Dr. D. Nope, didn't do that. We're kind of like staring awkwardly at each other in a closed room. So please, don't make it awkward for me. I want you guys to succeed. Okay. So number one is have your adjustments in rhythm. Okay. You think this would be common sense, but hey, life gets in the way, right? I cannot tell you how important this is. We have to build momentum in your case. We cannot make you better. Our goal is not simply to help relieve pain. We want to create stability so these issues, they don't regress and keep you in a tailspin and you getting the same results, right? So if you're constantly rescheduling appointments, you're constantly missing appointments, you're not going to get the results that you want. You think this would be common sense, but there's so many times. And I will say 93%, literally 93% of our practice is amazing at this. It's the other 7% that get my blood boiling. Number 2 is breaking your bad habits. Okay, so what are my bad habits, Dr. D? Well, if you were participating earlier, I told you to write down those 3 things: thoughts, traumas, toxins. This is what we're talking about. When we can start to focus on the mental stress, the physical stress. Are you exercising routinely? Not exercising is a physical stress. Our bodies are designed to move. Okay. Are you eating quality, good food? Right? When we can start to focus on these stresses, the effectiveness of your adjustments are going to improve. Okay, lastly is we got to start doing our corrective stretches and exercises to help these adjustments hold so we can retrain the muscles that are attached to the joints. Now, something to think about. I started thinking about this about a year ago. I don't even know how I started thinking about this, but I started thinking about this. Some patients in our office, full transparency, they get 100% relief in results from adjustments alone, like 100%. Some patients, 80% improvement from their adjustments. The other 20% that they needed was they needed to focus on those habits outside of here. Some people, 80% is from corrective exercises. 10% is from breaking bad habits, and the other 10%, they need an adjustment. Where you guys are on that I don't know, but if you want to cover your bases and give yourself the best shot, I would do them all, right? Okay, I promise if you guys do these 3 things well, we're going to be celebrating you guys. Okay, so let's go over some don'ts. When you start getting adjusted, typically patients start feeling good. Please don't get a false sense of security that because you're feeling better, that things are fixed. Quotations, right? Fixed, right? If you want to start exercising, just give me a heads up. Just say, hey, Dr. D, I want to start exercising. What should I do? What should I avoid? And we can talk about it, okay? Do we ice or heat after an adjustment? Ice. Okay. Now, let's imagine we're at home. We're picking up a shoe off the ground. We throw our back out. My back. Will we ice or heat? Ice, right? Okay. My back's on fire. It does not make sense to add heat to a fire. We want to ice and get rid of the fire. You can use that forever, right? Anytime something is brand new or it's a re-aggravation, we want to ice that. Okay. If you're someone who struggles with neck tension or headaches or shoulder problems, here's a freebie for you. Go to your car, pick up the headrest, turn it around, and put it back down. Now this in the forward flex position, it's used as a restraint, and if you're in a car accident, but in the short term, while we're adjusting you, this will help you allow to put your head back so we can get that natural arc that we want to use. Okay, guys, if the wallet is in your back pocket right now, please take it out and put it in your front. I'm not looking right now. I'm not looking. Please take it out, put it in your front pocket. Okay, this is an unprescribed orthotic that men put in their butts. It's an unprescribed orthotic that men put in their butts. It's the number 1 cause of sciatica pain in men. It causes a musculature imbalance in your lower back. Your low back compensates for that, and the spine causes wear and tear on the discs. Okay, put it in your front pocket. You won't get pickpocketed, I promise you. You're going to get pickpocketed someday if it's in your back pocket. Okay, ladies, high heels, anything that puts your foot into this type of slanted position, we want to stay away from as much as possible. Please save it for the fancy nights or fancy dinners. I don't think we're going to have to worry with anyone in this crowd, are we? Okay, please stay away from the high heels. These are the number 1 cause of hammer toes as well as bunions in females. They weaken our calf muscles. They lead to hyperlordosis of the lower back, which mimics pregnancy and destroys your lower back over time. Okay, some do's. We want to ice when we experience soreness. We want to stand or walk 3 to 5 minutes after each adjustment. I know that you guys have a very busy life. We try to make your care as effective as possible. Please stand and walk after your adjustment. It is counterintuitive to get an adjustment and have motion put back into the joint, and then you've run out of here and then become stagnant in your car and go back to driving to your house, right? We want to hydrate the disc after we get adjusted. We got a water station right here. It is possible not to see full growth, but if we can see a little bit of rehydration of the disc, it plumps up a little bit. That's going to allow the nerves to come out a little bit easier so they're not irritated. Okay. Talked about your corrective stretches. We'll explain what to do in a second for those. Patients in the past have asked me about diet. Now, just a little bit of side information. We have wellness workshops that we do that go deeper into dietary things on specific topics. You guys are always welcome to schedule a consultation with me if you want to dive deeper in any healthcare matter. It's free. Let the team know if you want to schedule a 15-minute consultation. But when it comes to diet, the day-to-day recommended amounts of vitamins and nutrients should primarily be coming through your diet. However, there are 3 supplements that I recommend for everybody as this a baseline maintenance program, okay? Number 1 is vitamin D. Where does vitamin D come from? The sunlight, right? It is virtually impossible to get the daily recommended amount of vitamin D through your diet. That's why I recommend to supplement it, okay? This isn't on here, but I recommend about 10,000 IUs a day of vitamin D. Number 2 would be omega-3 fatty acid. This comes from nuts, seeds, avocados, fish oil. Unfortunately, for us to get the daily requirement of omega-3, you would get mercury poisoning from all the fish that you would have to consume, okay? Now, if you're someone who has indigestive issues, so many Americans have malabsorption problems that they will often report, I don't like taking fish oil because I burp up fish. I'm kind of weird. I don't mind burping up fish and tasting it throughout the day. But if you don't, try krill oil. Krill oil is water soluble. You won't burp up fish, okay? Omega-3 helps with, it lubricates your joints so that when you wake up in the morning, you're not achy. It helps with mental clarity. It helps with women who have cycle issues during that time of the month. Really effective. Number 3 would be probiotics. The standard American diet is also known as the SAD diet, the standard American diet, and it destroys our guts from the food that we eat. And our gut has a little environment, a microbiome that has probiotics in them that help our bodies absorb nutrients. It's one thing to eat a piece of broccoli. It's another thing if your body can actually absorb it, okay? So probiotics are like a fertilizer for our gut. We get this from fermented foods like sauerkraut, kombucha, kimchi, and dirt. You guys eating dirt every day? Yeah, not lately, right? This is why we recommend to supplement it, okay? These 3 things, so many autoimmune issues could be resolved if people were just taking these on a daily basis, okay? If you guys can get these supplements anywhere, right? We have a trusted brand that we like here. It's called Dr. Mercola. If you'd like to try any that we have here, we give you 15% off your first purchase for coming to the workshop. Let's talk about desk work, okay? If you're someone who sits at a desk, this is really important, okay? When we come up to the desk, when we pull up and start to type, we want our elbows to be rested at our sides, and we should be able to type at a 90-degree angle. So many people in the past have sent me pictures of their desk setup and how they type, and their arms are extended like this and their shoulders are rounded. This causes tension along our neck and our shoulders. So when we pull up, we want to be at 90 degrees and type. Notice that the monitor on this position is slightly tilted backwards. If you tilt your monitor about 10-20 degrees backwards, your head will go from looking down to looking up. I'll give you the natural arc that we want to see. Okay, a couple things I would correct with this posture is we want the middle to bottom half of that monitor to be directly where your eyes are. So go on Amazon, buy a $20 monitor stand, get some old books, put it under that monitor and put it up. Lastly, when we sit, it is better for us when we're sitting that our hip is higher than our knee. This is why recliners are so bad. People come in all the time, oh, my back's so bad after sleeping in that recliner, right? It's because their hips are lower than their knee because their feet are way propped up. So we want to get a chair that we can sit with our hips above the knee, okay? Now, we got a big group with us here, but we're going to do a little stretch here. Now, with this stretch, I need everyone to listen carefully. Everyone put everything on the ground. We're going to spread out here. We're going to be seated in our seats. And I want you to spread out because in a second, you're going to be reaching out like this. So you may need to twist your chair, move your chair close to me so that you don't hit your neighbor. Okay. You can move way out, Barb, if you want to scoot clear out. Yep, to scoot around. That's fine. Rotate your chair. Yeah, Richard, if you want to come up here. There you go. Yeah, that's fine. Okay, everyone make sure you have enough space that you don't hit your neighbor, okay? Okay, we're going to do a little demonstration first. Now, imagine you're at the grocery store and you see somebody at the grocery store who looks like this. Just remember they are closer to the grave. That's a little joke, okay? Okay, they're physically closer to the grave, but I'm going to explain why they're getting closer to the grave. So everyone stick your head out as far as you can. Stick your head out as far as you can. Okay, now take a deep breath in. Breathe out. Okay, now raise your hands above your head. Head out still, head out still. Okay, relax. Now bring your head back so that your ear is in alignment with your shoulder. Don't look up, don't look down, just straight back. Take a deep breath in, breathe out, raise your hands. Okay, relax. Which one's easier?
Second.
The second one, right? Okay, so is our body smart or stupid? Okay, so if we're in this position, it's harder to breathe. What's our heart going to do?
It's gonna stress.
It's going to work harder, right? The heart has to pump faster to give us more oxygen. The heart pumps faster, raises the blood pressure. Our heart prematurely wears out, and we are closer to the grave. Everybody get it? Right? Okay, so we're going to do a life extension exercise, an extension exercise to help extend your life. So I'm going to have everyone sit up at the front of their chair. Okay, now arch your back and stick your belly buttons out towards the front or just forward, okay? Now imagine that you're driving a school bus and I want you to hold your hands out in front of you like so, okay? Now imagine that there's a pencil behind your shoulder blades and you want to pinch the pencil with your scapula, with your shoulder blades, okay? Hold it right there. Now, really important, with your head, I want you guys to retract your head just like so, straight back. Don't look up. Don't look down, bring it straight back. Hold it there for a second. You guys are probably starting to know some tension already. Okay, now take a deep breath in, and then you're gonna wrap your hands around your chair just like so, all the way as far as you can. Okay, and then breathe out. Okay, keep repeating. Really pinch the shoulder blades, keep the head back. Breathe in, go all the way back, yep, and then breathe out. This type of stretch, this is designed to help mitigate the day-to-day repetitive damage that happens when looking at a cell phone in a computer, right? To help extend your life. Okay, you guys can relax. Awesome. Okay, so we talked about stretches earlier. When you guys get to your first progress exam, you guys are going to receive an email from a company called Web Exercises. So based off of what we see with your progress, we're going to design specific stretches for you, whether it be your spine, your shoulder, your ankle. And all you have to do, open up your email, create a password, and all the videos will be in there, okay? I promise these are not hard, but this requires work outside of here, okay? Now, I want to show you guys some cool information here, cool study. So what is chiropractic care? What can it do for you in the long term, okay? So this was a 7-year study. This was done by Blue Cross and Blue Shield of Illinois. Okay, this looked at 800 patients over the course of 7 years, and they looked at a group of people who consistently saw a chiropractor versus those that did not over the course of 7 years. This is what they found in the group that saw a chiropractor. That group had a 60% decrease in hospital admissions. They saw 59% less hospital stays, 62% less surgeries in that group, and an 85% decrease in overall pharmaceutical costs. You guys want that? I want that, right? I've heard people say in the past, taking care of yourself is expensive, right? Do you guys know what the cost of not taking care of yourself is? Okay, I'll give you a story. I was at Thanksgiving at my grandparents' house this past Thanksgiving, and I'm sitting at the kitchen table with my grandfather, Bob. Lydia's there. My grandma's in the other room. Her 7-day pill counter is on the table. Guess how many pills that she takes a day? I counted. 44. 44 pills. And I asked my grandfather, I said, how much does all this cost? This is crazy. He says, I can't even give you a number. This is like even beyond me. And he said, but what I can tell you, he pulls out this 30-day pills, whatever. It's one of the commercials that you see all the time on TV. And he says, this one medication costs $4,000 a month. But don't worry, if you only make $90,000 a year, it's only $1,500 a month. What a deal, right? You guys realize the average cost for a nursing home in America is $10,000 a month? And if you need memory care, it's another $3,000 to $5,000. All your life savings is blown away in a couple months because you didn't take care of yourself, right? Small investment to take care of yourself, okay? This is where you guys are at. everyone here is in what's called the intensive stage right now. The purpose right now is we're trying to not only reduce pain, but create stability in your spine. At 4 months, this is where we do your re-exam and we take comparison x-rays and get to show you, hey, are you or are you not improving? Okay. Now, hopefully at this point, you guys are ready to graduate into corrective care. What I love about chiropractic care in a wellness setting, chiropractic care, when it comes to wellness is not just the absence of symptoms or disease, but it's the expression of overall function and well-being. That does not bode well with insurance. Okay. Now, when you think about insurance, do you typically pay more or pay less over time? You pay more typically over time. Do you typically get more or worse results? Worse results, or worse benefits, right? Now, the research I just showed you, 7-year study, over 800 people from, coincidentally, the insurance company, right? The reason why they don't pay, guys, they know the average person is going to dip within 3 to 5 years, and the other insurance company is going to benefit on what they invested in you. Do you realize that? That's why they don't pay, right? So the research shows that as you go along, you get more benefits over time with chiropractic care, but the cost that you paid already goes to 1/3 of what you've already paid. How cool is that? Right? That's what we want. Overall, this is what we help you get. Everyone in here has a potential that you can reach. That's what we want to help you reach, is your potential. Here are some of the patients in our office that have gotten to that point. So this is a patient. His name is Jeremy. Jeremy is like the 20th ever patient I've ever met in this office. We met him at a networking group. He is a roofer. He used to be a bodybuilder. He had horrible sciatica pain that went all the way down his leg into his foot. He had numbness. If I pressed on his tailbone, he'd jump out the chair because it hurt so bad. You guys can see how he's leaning to the left. He had a 15-pound shift towards his left side when he walked. At 4 months, this was him at 4 months, standing upright. This guy's climbing up and down ladders and holding shingles on his shoulder every day. No, this is Ken. Ken and his wife, Chris, both come here and they get adjusted. They're both in their 70s. And Ken originally came in with horrible neck pain. Okay. Now, about 2 months into care, he finally says, you know what, doc? My neck is feeling so good. I feel like I could stand on my head. And his wife, Chris, is in there. She's like, you could not, you old dog. Don't even try that. Well, like, what are you talking about? And he says, you want to put a wager on this? I bet you I could. I said, whoa. Hey, if you're going to do this, you cannot mess up the word. I've been trying so hard to get you to the point to say this, Ken. And I said, if you do, you need to put some pillows around yourself and please take a picture because I got to show this to people. And then later that week, he does this. How many 70-year-olds you guys know that could stand on their head, right? Thanks to chiropractic care, he can. Okay, this is Haley. Haley is my 5th ever patient in this office. She is a dog groomer 2 doors down. Okay, now she is constantly bending and lifting dogs throughout the day. Came in with back pain, horrible neck pain, and migraines. This was her at 4 months. You can see her posture. She's standing with the forward flex position, 2 inches of forward head posture. That's about 20 pounds of added stress on her neck. Standing upright, ear above shoulder. I just got to... I typically see her on Thursdays, and she just had her first child. I got to see her throughout her entire pregnancy. She had an awesome, healthy baby girl. All right, this is Noelle. I got to see Noelle yesterday with her mom, and Noelle's been a patient for about 3 years now, and her mom first brought her in not for pain, but for focus and attention issues. Okay, so she comes in, Nicole comes in, she says, hey, I heard chiropractic care can help with attention and focus problems. Is that true? And I said, yes, that's true. If there's stress on your nervous system, everything becomes spastic and a kid can't focus. We do our inflammation scans. Her inflammation scan is lit up like a Christmas tree. We start adjusting her. 4 months goes by, check in. Hey, how's the focus in school? This is the first time we've ever had no complaints at parent-teacher conferences. I said, that's awesome, right? When's the best time to deal with your health, guys?
Now.
Right now, right? This leads to the third reason. I know you guys have all been waiting for this third reason, right? Procrastination. This is the biggest reason they found that we're seeing these trends go forward of diabetes, heart disease, cancer. People know the answers. You guys aren't stupid, right? You know the answers. It's just whether or not you do it or not, all right? My word of advice is please don't wait until you're in a hospital bed on Thanksgiving when you should be with your family, okay? This is my grandmother. She sent this to me about 6 months ago. This is her left great amputated toe I was telling you guys about. She's on her 1970 Schwinn bicycle. She lost about 60 pounds because 3 days a week she goes to the YMCA with her friend Linda, and the in-between days they do water aerobics, and 6 days a week she's riding her bicycle. Okay, I promise if she can do it, you guys can too. You just got to start taking action. Okay, if you guys like this workshop, some of you have been referred to our office. Some of you have met us at farmers markets. Some of you have met us at lunch and learns. This is what we do, okay? If you guys ever want us to come to your work, provide free lunch like we just did, we'd love to educate your people. Let us know who we can get hooked up with and we'll get you guys free lunch. Just so you guys know, every other month we have more advanced workshops that we do. This is our foundational workshop, but this month we have a bone healing workshop that we're going to be doing. We're going to be teaching about certain things that weaken our joints, as well as things that we can start to be proactive as far as strengthening our joints. If you guys want to get engaged on our social medias, it does help us, but it'll also help you too. If you like or follow us on Facebook, each month we have a specific health topic that we teach about, either myself or we have certain posts. That will help you stay in the loop and get to better your health.